Hello everyone. So the next topic which I will be discussing here is about the testes, which is a part of the male reproductive system. So what is it consist of? So it consists of the male reproductive part or male reproductive system. So first we will be discussing about the male reproductive system. So here it is a diagrammatic representation showing the male reproductive system, which includes the testes, scrotum, spermatic ducts, sex glands, and penis. So all these organs, they work together to produce sperms, male gametes, and other components of the semen. So there are penis and urethra, which are a part of the reproductive and the urinary system. Then scrotum, seminal vesicles, vas deferens, testicles, and prostate, they constitute all the remaining reproductive system. So here the testes are being depicted here. Then rectum is being depicted. This is the rectum part. Anus, ureter, there is a bladder, there is a prostate gland, there is a vas deferens. So all these have different functions to play in the male reproductive system. So for example, if the male reproductive system, penis. So what is penis? As you can see, this is the penis. So penis, it is a three cylindrical spaces of erectile tissue, the two of which are larger, and the corpa canevosa lie side by side, and the third one is called as the corpus spongium, which covers the ureter. So this is what the penis is. Now there is a scrotum which is being represented here like a pouch like structure. So what is it? It is a sac of thick skin that protects and surrounds the testis. It also controls the temperature of the testes, since they have to be at a slightly lower temperature than the body temperature for a suitable sperm creation. Now I will be talking about the testes. So the urethra also, then urethra also, but first I will cover the urethra, then I will be covering the testes part, because testes is the main topic. So urethra, it is a tube-like structure that connects the urinary bladder to the urinary meatus. So in males, the urethra travels through the penis, and it is mainly involved in the two main functions. Urethra is involved in the two main functions. Now what are those two functions? This region is included in the urinary tract that takes the urine from the bladder where the semen is being ejaculated. Then the prostate exists beneath the bladder and covers the urethra. So the prostate grows larger with age, and if the prostate grows too much, it can block the urine flow through the urethra and is being responsible for the urinary symptoms. So this was all about the male reproductive system. Now we will be discussing about the testes. So what are testes? So testes, they are oval bodies which are around 1.5 to 3 inches in length. Generally, the left testes hangs slightly lower than the right one. So there are two primary functions of the testes. First is that it will produce the testosterone, which is a male sex hormone. That is the testosterone, which is a male sex hormone. And the second function of the testes is that it produces sperms, which is a carrier of the male genes. So these are the two main functions of the testes. Now, the testes, they are also known as the testicles or male gonads, which lie behind the penis in a pouch of skin, which is called as the scrotum. So where does it lie? It lies behind the penis in the pouch called the scrotum. So the testes, they move freely in the scrotum by but each testis is attached to the body wall by the thin cord called the spermatic cord. So it will be called as a spermatic cord. So basically which passes through a cavity in the pelvis and into the abdomen. So the cord contains the nerves and blood vessels for the testes, as well as the vas deferens, which carries the sperm from the testes into the urethra. So urethra, what is urethra here? Urethra, it is the passageway for sperms to the outside of the body at the ejaculation. So this is what is known as the testes. Now testes, where does the testes lie? So testes, they lie outside the body and they are maintained at a temperature which is about 2 degrees centigrade lower than the body's core temperature. So this is because sperm production and quality is optimal at this temperature. So what do testes do? So testes, they have two functions to perform. Now what are those two functions? Those two functions include, first of all, the testes will produce the sperms, and the second will be testes will produce the hormone which is known as the testosterone. So sperms, they are produced in the seminiferous tubules of the testes, and there are about 700 of these tubes in each testes. Each is the length of an arm and the width of a few hairs. The whole collection of tubules is longer than the football pitch. So once the sperms, they are produced in the seminiferous tubules, they pass into the epididymis, a long coiled tube in which sperms mature as they are conveyed along it. So they are then ready to be released at ejaculation via the vas deferens. Now, what are the role of hormones which are produced by the testes? So testes, the main hormone which is being produced by the testes is the testosterone, which is an androgenic hormone. So testosterone is secreted by the cells that lie between the seminiferous vesicle or seminiferous tubules, which is called as the Leydig cells. So the testes also produce, what do the testes produce? So the testes also produce inhibin B and anti-Müllerian hormone from Sertoli cells and insulin-like factor 3 and estradiol from the Leydig cells. Okay, the testosterone is important in the first stage of developing the male reproductive organ, that is the in a fetus. So it also causes the development of the male characteristic such as growth of the facial hair, then deepening of the voice, and the growth spurt that takes place during the puberty. So testosterone, it is important in maintaining these secondary male characteristics throughout a man's life. So from puberty onwards, testosterone provides the main stimulus for the sperm production. So it will provide the main stimulus for the sperm production from puberty onwards. Now, so the many things that can go wrong with the testes, and they can be grouped into two categories, that is the physical injury as well as the testicular dysfunctioning or disease or condition that affect the function of the testes. So these are the two conditions. Now we will be discussing each of these conditions in detail now. So first I will be discussing is the physical injury. So physical injury, in which the testes, they lie outside of the body and they are not being protected by the muscle or the bone. So any physical shock to the testes can cause the severe pain, bruising and swelling. So usually this is not serious, but very rarely a severe trauma can cause blood to leak into the scrotum. So this is called as the testicular rupture. So in this case, surgery may be needed to repair the rupture. So surgery in this case may be needed to repair this particular injury. Next type of injury, and it is one of the rarest form of injury which occurs, that is the twisted testicles. So what is happening in this? So this is when the spermatic cord becomes twisted from an injury to the testes or after the strenuous activity. It happens more often in teenage boys. So where does it happen? It happens more often in teenage boys. So this torsion cuts off the blood supply to the testes, and this is a medical emergency, and surgery is needed to untwist the cord, restore the blood supply, and save the testes. So this is one of the rare form of injury which occurs in the testes. Next is about the testicular dysfunction. So there are disease and conditions that affect the functions of the testes, and there are few reasons for the testicular dysfunctions which is caused by diseases and the conditions. So first I will talk about is the male infertility. So due to the absent or reduced sperm production, so there may be absent or reduced sperm production, or the production of the sperm that do not function normally, there may be many causes including the genetic and the lifestyle factors. So men with reduced sperm can undergo assisted reproduction with their partner. So there are microsurgical sperm retrieval, which is recently developed technique that has the potential to recover sperm from the men without any sperm. So however, it does not always work, but it is not widely available. So this is the technique. The next technique is about the cryptocordism. So this is the failure of one or both the testes to drop down into the scrotum before the birth. So they remain in the abdominal space. This can harm normal development and function of the testes and lead to infertility. So infants are often treated with an operation to bring the undescended testes into the scrotum. So this is the second disorder was. Then the epididymitis. So it is an infection. Where the infection is, as the name suggests, it is the infection of the epididymitis, which is caused by a general infection, tuberculosis, or sexually transmitted illness. So this disease can be treated with antibiotics. So next is about the testicular cancer. So it is the abnormal growth of the cells within the testes. So the growth can disrupt the normal function of one or both the testes, and it is most common in young men. So there is an urgent medical treatment which has been required in this testicular cancer. Then next is about the Klinefelter syndrome. So this is a genetic condition which stops the testes from developing normally. So as a result, the low levels of testosterone are produced or released. So there is a low level of male hormone, that is this testosterone, which is being produced and released. So there are other factors as well that can affect the function of the testes, that are radiation, chemotherapy, certain drugs, and disorders of the puberty gland that stops the signal from the hormone system and that trigger the production of the testosterone from the testes. So this was all about the testes. These are some of the references.